I have the great pleasure now of being joined by ADA President of Medicine and Science, Dr. Robert Eckel. We have so much to talk about, so let's begin with the big picture and the forecast for diabetes in the United States. The numbers are pretty staggering.
Well, diabetes is increasing in prevalence in the United States, and I think this raises a great concern in many, many ways. Not only for the people who live with diabetes, but ultimately the economic costs that relate to diabetes care. We've got a big problem here. We got to start figuring out how to face it.
And when you're trying to figure that out, you look at those numbers that are particularly disturbing, 629 million projected by 2045. What right now is the biggest challenge for both researchers and practitioners?
Well, the 629 really relates to the global prediction going forward in terms of diabetes around the world. You know, one of the biggest factors that relate to diabetes incidence and prevalence is the obesity epidemic. We're talking about the coronavirus pandemic, but if you will, obesity is an epidemic now impacting almost every area of the world, particularly urbanized societies. And the other issue relates to underserved populations who have a much greater likelihood of developing prediabetes or type 2 diabetes. Again, obesity is a driving factor, but there are many other things we need to understand much better to try to prevent this global epidemic that's predicted for the next 10 to 20 years.
Doctor, you bring up the pandemic, and one thing we know is that people living with diabetes are seeing an added burden once they are diagnosed with COVID-19. So what is the ADA doing to advance the science, to learn more? It's such an ever-changing situation.
What the ADA has done is they've stepped forward with a series of webinars that inform the public as a whole and healthcare providers about how COVID-19 affects patients living with diabetes. But moreover, importantly, the ADA has just put forward a $1 million expenditure to fund grants that relate to diabetes and COVID-19 that will be funded over one-year intervals, and perhaps some 10 applications will be peer-reviewed and funded for that purpose.
Clearly, the more we learn, the better the outcomes. Okay, we've talked about some of the negatives, some of the challenges. Let's talk about some of the positives. And what is some of the key research really going on all over the world to help patients and clinicians deal with diabetes?
For type 1 diabetes, we know a fair amount about the genetic predisposition to develop type 1 diabetes. But what we don't know are all of these environmental factors that do impact that genetic risk. This is a black box with insufficient information to think that vaccine development, for instance, can follow to protect young people or even adults at risk for type 1 diabetes in terms of getting type 1 diabetes. For type 2 diabetes, why does diabetes exist in some obese people, but not in all obese people? Because the beta cell, the cell in the pancreas that makes insulin, is defective in type 2 diabetes, where in the obese people that don't get diabetes, it's not defective. In other words, what is the mechanism by which patients with diabetes have an inability for the beta cell to produce enough insulin to keep blood sugar normal in that setting? These, in my opinions, are the two most targeted areas of research that need special attention.
And the research really is key. We've spoken about the big picture. Now let's hone in on specific goals for the ADA in the next year.
Even though we're funding the COVID-19 diabetes-related project over the next year, many new grants were not funded now because of insufficient funds to continue to fund people for 3 years going forward. So I think this is incredibly important. The ADA needs your help, your service, and ultimately your money to continue the mission that we're facing. And remember, no money, no mission, no mission, no money.
Well, since you pivoted into this virtual conference, I hope that it will keep more people connected. Dr. Robert Eckel, ADA President of Medicine and Science, thank you so much.
You're very welcome. Thank you very much.